How are thyroid disease treated? Interesting about science and medicine prepared by editors of a channel All Scientifica. The cause of hypothyroidism and hyperthyroidism according to doctors may be a very low or very high ability of a small intestine to absorb iodine. From this we can guess that there is a very strong connection between this disease and diet. A diseased intestine can cause an imbalance of iodine in the body. Treatment of thyroid disease also required change in diet, bowel cleansing, liver support, and restoration of impaired metabolic process. The most commonly used medication for the treatment of iodine deficiency are Liothyronine, Levothyroxine, Potassium Iodide. When treating thyrotoxicosis, the following drugs are suitable: thyrostatic, which have an inhibitory effect on the formation of a hormone in this endocrine organ; Mercazolil, immunomodulators, antihistamine, glucocorticoids. When treating nodular and diffuse thyroid goiter, you need to focus on reducing the load on the functionality of this organ. Thus, this will not create additional stress on the gland, and it will work normally. The main medication for the treatment of disease of this endocrine organ contain thyroid hormones, Thyrotoxicosis, thyroidine, Levothyroxine, and their analog, antithyroid drugs, Mercazolil, and other drugs that contain iodine. Harm from iodine-containing medication. In the case of thyrotoxicosis, coronary heart disease, diabetes mellitus, drugs such as triiodothyronine and thyroidine are contraindicated. Mercazolil in some cases can cause leukopenia and granulopenia. Mercazolil in some cases can cause leukopenia and granulocytopenia. It is also contraindicated in pregnant women and in the presence of nodule on the thyroid gland. Iodine preparation should not be used during pregnancy, with the exception of vitamin preparation containing iodine and iodized salt are ever recommended for pregnant women, for kidney disease, for allergic disease with neoplasm of a thyroid gland. How do hormonal drugs affect the thyroid gland? The use of hormonal drugs reduces the load on this organ due to the fact that we supply the body with the necessary hormones with the help of drugs. It turns out that this gland will work less and some change will be noticed, but it's still too early to rejoice. If a problem that caused the thyroid gland to get into this state has not been identified, then we have done nothing. If we continue to take hormonal drugs without identifying the real cause of disease, then we will be forced to increase the dose. By increasing the dose gradually, the patient can provoke another problem, a decrease in thyroid activity to critical parameters, and then even atrophy of this organ. What to do, because when the course of medication is stopped, the nodes begin to grow again. Hormonal medication for thyroid disease are taken only in certain cases to assess the condition of a thyroid gland if there is no other way to diagnose, but this measure is temporary and the drugs are taken only for a certain period of time. With the thyroid gland removed as a result of surgery, in this case the patient must take these drugs for the rest of his life. It is also very important to know that taking medication that contain hormones lead to bone loss, promote osteoporosis, and can disrupt the function of heart cells, increasing the risk of atrial fibrillation, a condition very similar to cardiac arrest in older people. Side effects of thyroid nodule removal. By removing nodes on this endocrine organ, often the entire thyroid gland, we do not get rid of a body's load on this organ. We just getting rid of one of the effects. As I already said, removing nodes on the thyroid gland will not solve the problem, but after a while other nodes will appear. By removing one lobe of the thyroid gland because of nodule, they will later appear on the other lobe. Also, we must not forget about the parathyroid gland. They are simply also removed during surgical operation on the thyroid gland, but they also have their own important function. Treatment method for thyroid disease. The most important method of treating thyroid disease is to eliminate the factor causes and conditions that provoke this disease. Mainly, problems with the thyroid gland appear due to a lack of iodine in the body. By taking various food, especially seafood, we replenish some of iodine deficiency. To completely prevent iodine deficiency, it is recommended to use table salt enriched with iodine in food. Pregnant women should take vitamin supplement containing additional iodine. Other types of iodine preparation are used only under supervision of a doctor. Thank you for your attention. This material is prepared on the basis of a page or scientific. Attention, this material is for information purposes only. When observing very unusual symptoms, it is recommended to consult a doctor. Subscribe to our channel. Thank you. Bye bye.